My name is Liz Mitchell, and I'm the Project Development Manager for the Love Inc. project. Thank you for joining us today while we explain a little bit to you about our journey exploring how we ensure that love is a fundamental element of all children and young people's care experience. We've been doing that over the past 3 years, exploring alongside adults and children how we can find out and make sure that love is something that all of our care experience children feel in their lives. So I am the project development manager, and I've been leading on the Love Inc. project since it started in January 2019. The Love Inc. project also has a small team of staff, two project participation assistants who are Erin and Rianne, and we also have Sky, who works with us on a relief basis as a participation assistant and has also been an intern and a volunteer with us too. So that's who the Love Inc. project team are. So I'm just going to explain a little bit about what our session will be today. We're going to think about why love is so important for our children, and particularly for children who've experienced some form of developmental trauma, and why it's so important, not just for them to survive, but also to thrive and to go on to have loving, positive relationships in their future. We'll explain to you about our project, how it came about, and how our work aligns with both current priorities in Scotland and with the what's going on within the Promise and the Independent Care Review. And we will talk about the work that we actually do, how we explore love with children and adults, and what we found in terms of how we can ensure love can flourish for our children. I hope that all sounds okay to you. So, as somebody who says the word love lots of times a day to a variety of different audiences, I'm aware of the impact on people when I say that word. Some people love hearing it. They're delighted to hear us talking about love in such an open way in a professional setting. And they feel really reassured and emboldened by what we talk about because it aligns with their values and how they see the work that they do caring for children and young people. But for some people, it can be uncomfortable. It can cause discomfort. It can cause real concern, genuine concerns about boundaries and about professionalism and where love sits alongside that. And for our young people, it can cause discomfort. It can cause it can be an opportunity to be heard on a subject that they really want to talk about, but it can be embarrassing. It can be confusing. And it can be something that they just want to disengage from. So it is complex, it is abstract, and it is totally subjective. And that's what makes it hard to talk about it in a professional setting sometimes. We also get told regularly during our sessions with adults, and particularly when we do training that extends to other countries and other professionals and other professions, and we get told that it's brave and it's ambitious talking about love in the way that we do, and about the need for everyone who works in the care system to be love-led in their approach. But we don't see it that way. We don't see love as being ambitious for our children. We think that an expectation of love for our children and about thinking about how we can ensure that happens for them, regardless of what our role is in their lives, should be an essential part of our responsibility as those who work in the system that cares for them. We are starting this session with a loving mindset. This is something that we normally start our interactive sessions with. We do a Mentimeter activity online. And we started using this platform during the lockdown to gather adults and children and young people's views and experiences. And the reason why we did this was because of the fact that it was anonymous. It could be viewed in real time. People could be really open about what they wanted to say. And the fact that we could save all this data really helped us within our research project and gathering views and experiences of others. So what we would do at the start of our sessions, whether it was with adults or with children and young people, we would ask people to share the last loving thing they did for someone else or the last loving thing that someone did for them. And it got people into a really nice headspace at the start of the sessions, thinking about love in relation to themselves and relation to their own values and what feels good to them and what feels loving to them before we started exploring it in a more professional context. So I'll tell you a little bit now about the background of the Loving Project. As I said before, we were a 3-year partnership project and we were funded by the Life Changes Trust Workforce Development Fund. Aberlour is the lead partner of the project, and our other partners are the Care Inspectorate, Celcis and Includem. So the seeds for our project were sown at a Loving leadership event, which was hosted by the Life Changes Trust in 2018. And that leadership event that was hosted by the Life Changes Trust involved young people with lived experience and the adults and leaders who were working within the care sector at the time. The event itself generated some conversations about what it would take to put love at the heart of the care system. And the conversations at the event highlighted that despite the good intentions of adults in the care system, there was still a gap for children and young people, and they were expressing the need for more to be done to ensure that they felt loved. So following this event, the senior managers from our partnership organisations decided to collaborate and apply for funding from the Life Changes Trust to work on a project together which would consider this question about love and how we can ensure our children experience more of it. And we would explore that from a workforce development perspective. So as I say, Aberlour is the lead project partner, and Aberlour is one of Scotland's largest children's charities who help to improve the lives of Scotland's children and young people. The Care Inspectorate, our second partner, is an independent scrutiny, assurance and improvement support public body for care in Scotland. Celcis is the Centre for Children's Care and Protection, and the Centre for Excellence for Children's Care and Protection, and it's based at the University of Strathclyde in Glasgow. And Celcis work to improve children's lives by supporting people and organisations to drive long-lasting change in the services they need. And Includem are a Scottish charity that works directly with children, young people and families, using a model of support which is based on solid relationships of trust. And they provide intensive, bespoke support to children, young people and families in challenging circumstances to help them transform their lives. So our partners provide us with support and expertise in a range of areas, such as research and evaluation, from a regulatory and scrutiny perspective, and as service providers. So a little bit of background to the Life Changes Trust. They were created in 2013 with a 50 million 10-year endowment from the National Lottery Community Fund to help drive transformational improvement in the lives of young people with care experience. So we've made a video with Mari, who is one of the evidence and influencing officers for the Life Changes Trust. And we talk in this video about what both ourselves, the Loving Project, and the Life Changes Trust have found out about the importance of relationships and relationship-based working, and also about how the Trust's approach to working and funding allowed Loving to be love-led in its own approach. Furthermore, and finally, the ability of our funders, the Life Changes Trust, to allow us to work in this way provided us with the flexibility and adaptability to embrace the complexity and the uncertainty of working within a pandemic, and the nature of the subject that we were exploring, which was the human emotion of love. So, partnership working, our partnership approach. Partnership working provided us with Some amazing opportunities for growth, for learning, for innovation, and for supportive challenge. Our shared values as organisations and our willingness to embrace the complexity of our subject matter was absolutely key to the success of our partnership. One way of explaining our approach can be through the collective leadership model, which I've put a slide up for here, but you can also check more out about that on the Collective Leadership Scotland website. We have links to everything in the project report. But to explain it very briefly, rather than seeing leadership as one individual who creates and changes things that happen, collective leadership is where multiple leaders come together to address problems. And it's best to think about collective leadership as actions rather than as a position. So when the project began, we were aware as a project team, as a partnership team, that we didn't yet know what we would find out on our journey. So we had to develop a shared understanding of the importance of emergence and of being comfortable with the unknown. This was absolutely key to the positive partnership working relationship that we had. So in terms of the individual organisations and how they supported us to work collectively and to work in such an effective partnership way, the Care Inspectorate, as the independent scrutiny, assurance and improvement support public body for Scotland, have provided us with many opportunities to work alongside inspectors, corporate parents and other organisations such as Health Improvement Scotland. This partnership has allowed us to explore the complexities and the issues around regulating for love and what love looks like for children and young people in different care settings. It's also helped us to think about how we can really meaningfully involve children and young people in thinking about their care and whether they experience love in their care. So Aberlour and Includem are values-based service providers who work directly with for children with care experience. And they employ practitioners who are experienced, who have strong values bases, and were willing to share their knowledge and their views and their experience with the project. And allowing us to have that direct access to the workforce has provided us with a theoretical and a practical understanding of the importance of relationships when working with children and young people who've experienced care. And Celcis, as the Centre for Excellence for Children's Care and Protection, have provided us with so many opportunities to collaborate, to share knowledge with other organisations, to engage with and become part of participation networks, to contribute to and to influence discussion around the national approach to supporting children and young people with care experience. And it's provided us with access to a broader understanding of theoretical frameworks and constructs and current research within the care sector, both nationally and internationally. And in addition to this, they've provided us with so many opportunities to share our learning and our journey on a wider platform than we would have had access to as a standalone project rather than a partnership one. So I hope that gives you some kind of insight into how important the partnership working element of our project has been for us and for our success. Just here, though, I've put a slide, a video in for you to watch, which is about our involvement with the Care Inspectorate and their Professional Development Award programme. So as I say, we have had strong partner relationships with all of our organisations, and the one with the Care Inspectorate led to us becoming involved in the presentations for the Professional Development Award that the Care Inspectorate runs. So in this video here, I chat with Scott Morrison and Lynn Williams from the Care Inspectorate Professional Development Award programme. And we talk about how our partnership working evolved, the journey that we've been on, and the key learning that we've taken from this. Good morning, Scott and Lynn.
Good
Morning.
morning.
Hi, thank you so much for joining me today for a little chat about the work that you guys within the Care Inspectorate have done with us in Loving. I'm Liz Mitchell, and I'm the Project Development Manager of Loving, as you guys know. And I'm just wondering if you could introduce yourselves and just tell us a bit about your roles before we start chatting about the work.
Sure. Hi, everyone. I'm Scott Morrison. So I'm the Professional Accreditation Advisor within the Care Inspectorate, and part of my role is to manage the Care Inspectorate's SQE Assessment Centre. And our assessment centre delivers a course which is a professional development award in scrutiny and improvement practice for our inspectors within the organisation.
And my name's Lynn Williamson, and I'm a tutor assessor within that Care Inspectorate Assessment Centre that Scott spoke about. And I support the candidates who undertake that qualification and assess them on their journey through the award.
Brilliant. Thank you so much. For anybody who's watching who doesn't actually know anything about the Loving Project and our partners, the Care Inspectorate are actually one of our partnership organisations. So we've been working really closely with the Care Inspectorate over the past 3 years of the project. Various pieces of work. We've done training and development with inspectors, and we've worked really closely with one of our partner leads, Mary Morrison. And Erin, who works within the project, she was a young inspection volunteer with the Care Inspectorate as well. So we've had really strong connections with you guys right through the project. But it was this kind of specific work that we did with you and the Professional Development Award and the candidates for that I was hoping we could have a little chat about today. How did the opportunity to start working with Loving come about from your end?
I guess I guess from an early stage in developing the qualification, the course itself, Lynn and I always had a vision for a co-produced, genuine and meaningful approach to working in partnership with a broad range of stakeholders in terms of the qualification. And I guess what we realised was having the vision, that's straightforward, that's the easy bit. To then kind of find how do you get that kind of foot in the door? How do you get it started? That was the bit that we were really struggling with. I guess in reality there was an element of luck, and us recognising where opportunities existed, and that really came about through Mary Morris, as you'd mentioned earlier, and joining our team and becoming a tutor assessor on the course. And through discussions with Mary and that kind of vision that we had for that kind of partnership and co-produced working, she then introduced us to the idea of Love Inc. and the work that Mary had been doing with Erin. And that's so it was almost quite an organic development in many ways. Don't know if you want to say a bit more about that, Lynn?
Yeah, I mean, I just totally agree. We talked about it. We talked about different approaches, who should be involved, and even internally within our organisation, it was quite difficult to identify who we wanted and how to engage. And Mary came along and brought that kind of missing link, that piece in the jigsaw that just wasn't there. And the initial working that Mary did with Erin, and Erin came along and spoke to our PD cohort, gave them feedback on her role as an inspection volunteer. The success of that and the impact of that, which we'll probably go into a wee bit later, but that was kind of the snowball effect that then made us want more, that this was the right thing to do. And how do we create more opportunities, and how do we engage much more in a co-produced way moving forward through the programme? So yeah, it was very organic and a good amount of luck, but I think because Scott and I had the vision straight off, we knew what we wanted to do. We just needed that conduit. We needed those connections and network to make that happen.
Yeah, that's what you're saying there about the connections and the relationships. That is so, so key. I think, for us, Mary as a partner. She has enabled us to, like, she's opened up, you know, doors to opportunities for us that we wouldn't necessarily have been able to get to ourselves, you know. So for us to be able to talk about love and spread that message in the way that we've been able to with, you know, the scrutiny body has been incredible. So having that connection with Mary, and Mary having that connection with Erin, who, you know, has been a real key part of this whole project, that we will go into in a minute, that enabled this to happen in a really natural way, didn't it? So I think, you know, we certainly found that throughout the project, connections that we make and the connections that our young people make, and how they can continue throughout their lives, makes such a fundamental difference to where they go on next in their futures, you know. So that's really lovely to hear that was an outcome of what the work that we did, because that's definitely something. So what was it that actually, you know, that we actually did together? Would you mind kind of explaining a wee bit about what the PDA is, and what the bit of work that we did with you guys in the PDA? Would that be okay?
Yeah. So the qualification has a structure and a framework to it, and there was a piece of work we wanted to do about involvement, about participation, about collaboration, and that was the part that Erin came in and used an interview technique with Mary to sort of explore from an inspection volunteer perspective, and then there was an opportunity for questions and answers, and the participants on the qualification were then doing an activity that she was given feedback on. So the feedback that we had from that session started us thinking about how can we engage in other parts. And I think Erin had by that time moved into Love Inc. and Mary was that connection. So we started to explore sort of different opportunities. This is a golden thread. It's fundamental to scrutiny practice. It places people and the voices of people experiencing care at the forefront of expression of not just love, but that compassionate approach as well. So it's all encompassing in that element. Now, the pandemic hit just about the time when we were exploring how we could actually take this further. And that gave us a new opportunity here, because there was a number of candidates who had to pause and had to frontline face and work and support the actual role of the Care Inspectorate during that time. But there were some candidates who were able to be supported a wee bit to continue their studies to a completion. Now, those studies culminate in a project, an improvement project, where they're actually using all the learning from the qualification to actually demonstrate that they can take a leadership role with an improvement, with an outcome. So it's a project format, and our thinking was actually what we normally do at that stage is get the candidates to present to us their idea. And then as an individual tutor, I would then help and support them to hone that idea and ensure that it's actually smart and it will actually meet the requirements of the qualification. So this time around, because we were now starting to work in this virtual environment and working from home, rather than seeing it as a barrier, we saw it as an opportunity to be able to engage with yourself and Erin in a much more meaningful way, that there wasn't these barriers in terms of attending venues or finding core dates and travel time and all. So it actually broke down a lot of barriers. Because we already knew Erin and Mary had the connection with yourself, some of the relationship bits just fell into place really, really nicely. And we had some orientation meetings anyway in the lead up prior to COVID and then as COVID hit. So I think we had that opportunity to bond and build the relationship between the PDA and Love Inc. prior to actually then reintroducing what it was we were looking to do. And it was, I think it was through those discussions, Scott, you can correct me if I'm wrong, but when we were planning, okay, where is the opportunity? How are we going to engage? I think that again was organic. It was like, well, here's what the candidates are presenting. What do you think? What would be the best approach? How do we approach that? And it was at that point that we were thinking about, yeah, okay, what we don't have is that experiential voice coming in there that needs to guide those candidates. That's not just about inspection. Think about it from the perspective of the person who's experiencing that. What's their emotional experience? What's their involvement and participation? What's the outcome from what you're doing that's going to impact on their emotional well-being, as well as the quality of the services provided? So I think that in itself became really, really organic. So yeah, Scott, do you want to take over about then how we took it into?
Yeah, I think that the recurring theme is that organic nature, isn't it? And I think that that's really important to emphasise, that in terms of us really wanting this to be genuine partnership, then that becomes fundamental. So we were consciously trying to come into this partnership working without fixed ideas of what we were wanting from it or how that was going to be achieved. And that's what a lot of those early meetings were about, really, wasn't it? Was that sharing of ideas and how do we think this might work, and what do we think that the outcome might be, and what would success look like for all of us. So I think that's been really important. And then to work with the inspectors as well, because this was a new way of working for us on the course, and introducing that to inspectors, that actually what you're doing, what we're asking you to do is present your project plan to a panel effectively. But actually it's a really supportive panel, that this isn't about us assessing, that this is about us really trying to support the project, and it's an improvement project, and how can we support that and maximise the value and the outcomes from that project itself. And I think that then the real strength in that was that range of different perspectives that we were getting. So we all brought something different into those meetings, and we were able to have that really generate a really positive discussion with the inspector around the project, but start to question it and offer different perspectives. Have you thought about it from this point of view? And Erin was amazing at doing that, from the perspective of young people and people with care experience, and that was so important in actually driving the focus of the project itself.
Yeah, I think from our perspective, like when we started working with you, your real passion, like you say, it was at the core of what you were doing with the PDA. You really, really wanted people with lived experience to be a part of that process, and them to be meaningfully involved, not tokenistically involved, but to actually, for what they were saying and what they were sharing, to really have an impact in terms of the work that the inspectors were doing for the PDA. And I think because you were so open to the flexibility of, let's just see how it goes, let it emerge and see what we can do. And because we, like you say, we were all bringing different things to the table, it did become something real, really meaningful, and that you could see that in terms of the responses from the candidates. At the end they were like, oh, I was really nervous about it, but it was lovely. It was they were expecting it to feel a lot less nurturing maybe than it actually was, and they seemed to get something really positive from the experience of us all sharing ideas and thoughts together about how you really meaningfully include young people. So we got that sense as well. Absolutely, we knew that you guys were in the same place with us in terms of what participation should look like and how it should be meaningful, and we felt that the inspectors got something really positive from it too. So that's lovely to hear that you guys felt like that as well. I suppose we've kind of talked a little bit about what the benefits have been. Has there been any other benefits that you can think of in terms of for the inspectors or for you guys in terms of your roles?
I think there's twofold. I mean, if I take the inspectors, I mean, the feedback that we got, not just in terms of what the inspectors then produced or took cognizance of within their projects in terms of participation and the voice of people experiencing care through everything we do as a scrutiny body. There was also direct feedback on what you spoke about there, the feelings that they had about it. So they already had a connection to Erin from the input that Erin had given. They'd already recognised aspects of their role and the processes tied up in that where there were opportunities that could be explored to be done differently and maybe expanded on. But I think they got what you spoke about there. It was the passion and the honesty that what we were doing was meaningful, that this was about change. This is about listening to other perspectives, but actually taking action. So not just doing it tokenistically, like you said. And I think that was infectious for them. I think that's what they were picking up, is that this is actually being done. We're role modeling it, but equally we're all speaking the same language, we're passionate, and we're looking for that impact, we're looking for that change. So a couple of them actually, I know one of them approached you to actually come and speak to their team because they felt that your actual involvement in shaping or helping them to understand participation to shape their project slightly differently was massive, and they thought that was infectious. So they had approached you to come and speak to the team, because I think our comment was every team in the Care Inspectorate should have Love Inc come to one of their meetings. So I think there's a huge strength in that as well. So it's almost that ripple effect, that your involvement with the PDA can effectively bring about change across the organisation. But other inspectors spoke about practice changing. So it wasn't just their perspective that was changing, but they were actually writing up their public reports differently to try and actually get that perspective meaningfully from what it was like to living that service across or access that service, to get that across within their actual public reports. And a few of the other ones suggested that they hadn't quite considered all the creative avenues open to them. So Erin, for example, had given someone a good icebreaker to do in terms of an online focus group with children, and they hadn't thought of things like that. So it was even those kind of creative ideas that affected change.
Oh, that's great.
And I think what's brilliant in just sitting talking about this and listening to it as well is recognizing that we're only part way through this journey as well, and there's so much more potential in working together. And what really strikes me in what we're saying just now is that so we've made those inroads in terms of partnership working and hearing voices. We need to then really further develop and further model that in terms of closing that loop. And how do we feed back? How do we measure what the outcomes of those are, and then feed back to the people that we've involved in that process? So
that's absolutely key, Scott. You're so right. So many young people that we talk to, they come back over and over again and go, you asked me about this, but then you've never come back to me and said what it meant or what happened. And so that has been a fundamental part of what we've been trying to do, is always coming back with closing that feedback loop every single time we do anything. And it is one of the bits that people seem to miss. And so that makes me so happy, because I know that this is what we're going through this journey together. And we're like, that's the bit that we need to now start thinking about, is getting people involved and then them knowing what their involvement has done, what the impact of that has been, so that's really exciting. And you're right, it's just the start of the journey. It really is. And I mean, we've done other things together, haven't we? We've been, we've spoken to people from all over Europe and things like that, haven't we?
Yeah, absolutely. And I guess that's almost that sort of feedback loop component of it. Sometimes you don't close the loop, sometimes you open up another loop, and that's really what happened there. That in working with yourselves, we then we started working more closely with our own working together group within the Care Inspectorate, and that led to an opportunity for us to present how we've been working with yourselves and developing that partnership working to an international audience of regulators. And Lynn and I had a discussion saying that's brilliant, but yeah, we're not doing that by ourselves. Why would we do that by ourselves? Because we need to do that in partnership with Loving. So that opened up that next loop of us having another meeting then to say, look, we've got this opportunity. What do you think about being involved? Do you think Erin could be involved? You know, and that, so. And that was received really, really well by the international audience themselves, and generated a lot more interest in how the Care Inspectorate was undertaking partnership working, but also a lot more interest in Love Inc. and what you were trying to achieve in Scotland.
Yeah, they were really like, wow, that's really it's really brave, you talking about love like that. We're like, no, it's not. It should be the way that everybody talks about love. But I think for us, that was an amazing opportunity again to be able to talk to people about what we are talking about, but in that huge, that global context. You know, we know that love is it's a humanity thing. It's a universal thing. We need to make sure that it's our entire culture and society that's thinking about, you know, our young people and loving our young people in that way. So it's so amazing for us to get the opportunities like that with you guys to go and do something on a you know, international level. But I think more than anything is what you said, Scott, about you got that opportunity and you went, well, we're going to ask Love Inc. Why would we not ask them? That's meaningful participation. You know, you didn't even think twice about it. It wasn't like, oh, I guess we better add it on and ask Love Inc. It was like, well, of course we'll ask them. We've been doing this work together. This is part of our journey, isn't it? So that, you know, that in itself is just, I think, a lovely example of work that we've done, that we do work in real, genuine partnership together, and what we do is co-produced. So I think on that lovely note, I will say thank you so much to you both, not just for joining me this morning and really articulating so beautifully what a lovely bit of partnership working we've been doing together, but thank you as well for just working with us over the past 2 years and giving us so many opportunities to share our message and for our voices to be heard, and to just work with the lovely team that you both are. So, and June too. So thank you. And I'll say goodbye to you now, and I'll stop recording. Thank you very much, guys.
Thank you.
Thank you.
So, why does love matter? Why is it so important? Well, the reason why it is so important is because love is absolutely fundamental to our survival. Humans are social creatures, and we crave and seek out connections. Without healthy, positive ones, we can't function in a positive way. I think we all experienced this for ourselves firsthand during the first couple of years of the pandemic, and when we had to isolate ourselves from people that we loved. Love is also absolutely essential to brain development in the early years of life. And the early interactions between babies and their caregivers have lasting and serious consequences on brain development. So positive, loving interactions or stressful, traumatic interactions build the neural pathways and connections in a baby's brain, which subsequently guide how we respond to experiences throughout our lives. And this early development, when it's impacted by trauma and negative experiences, significantly affects future emotional well-being. So early trauma can arise from things happening that shouldn't have happened, such as separation, abuse, loss, or medical interventions. And it can come from things that didn't happen, but that should have happened. such as from emotional and physical neglect or from disrupted attachment. Many children who've experienced care have also experienced developmental trauma in their early lives. And as we know, a child who does not feel safe primarily lives in their fight, flight, or freeze responses in order to survive the real or the perceived danger that they face in life. And one problem for traumatized children when they move into a safe space is that the survival responses that they've learned throughout those years that they were unsafe don't turn off. And a traumatized child is developmentally stuck in this part of their brain, which means that very little information can get passed up to the higher parts of their brain, where processes such as learning and retaining new information, reasoning, learning, goal setting, sharing with others, empathy, and most importantly, trust can occur. This is called neurosequential development. So there's been research by the neuroscientist Dr. Bruce Perry, and that has shown us that the experience of early loss and trauma does not need to dictate a child's future in isolation from other important factors. So in other words, there are other influential experiences in a child's life that can be a buffer for the impact of early adversity. And more influential for the child than their early trauma is actually the quantity and quality of their safe, trusted relationships. And it emphasizes the importance of having those consistent, loving relationships throughout the lives of children who have experienced trauma. So our understanding of the importance of healthy, consistent, loving relationships and the impact of that on brain development, and how we can use them as a way to respond to and heal and repair trauma that's been experienced, is a fundamental element of the reframing of approaches we use to support our children and young people who experience care. So in October 2016, the First Minister made a commitment that Scotland would come together and love its most vulnerable children to give them the childhood they deserve. She commissioned an independent review into the care system to learn how we could deliver on this promise. These are some of the foundations, the 5 foundations of the promise, which gave Scotland a real clear and simple starting point in terms of transformationally changing the care system. There is an ongoing momentum just now within Scotland and a real expectation for organisations and structures within the care system to keep the promise and to continue working towards making those changes that are vitally needed to ensure that care is a loving experience for all our children and young people. So, as I said, the promise is built on 5 foundations, and they must be at the heart of the reorganisation of how Scotland thinks, plans, and prioritises for children and families. Loving relationships and feeling loved by those who care for them underpins all the 5 foundations of the promise. As I say, they are voice, family, care, people, and scaffolding. And the promise states that Scotland must move away from processes towards relationship-based understanding and approaches. So in terms of how we embedded the promise in Loving, we ensured that voice and the voice of our young people that were both working in the project and were engaged with the project was at the heart of what we did. We supported young people when talking about family, and we gave them an opportunity to discuss those loving yet complex relationships. And we broadened their understanding of love and talked about it being about nurture, support, and safety. In terms of care, we encouraged and we led conversations with the workforce about ensuring that our children's homes were loving environments. And we explored with young people what parts of their homes and the care they received in their homes felt loving. And we shared this learning with the wider workforce. In terms of the People Foundation, we actively supported people within the frontline and the wider care workforce to think about the importance of their interactions and their relationships with young people, and to reflect on their practice and to think about what they could do to make it loving. And finally, we scaffolded our young people who worked within the project to ensure that they experienced a real positive first working environment and that they felt supported, nurtured, developed, valued, and cared for within their roles. So, Loving has worked within 3 ways. We have worked alongside children and young people from Aberlour residential houses and from other organisations whom we've built relationships with. We have supported meaningful engagement and activities where love could be discussed and explored in a safe way and using a trauma-informed and responsive approach. That's how our relational participatory activity. In terms of our insight activity, we provided workshops and training to adults who worked in care to think about how they could explore both their own and children and young people's understanding and experience of love. And we explored and considered with them the barriers and enablers to them working in a loving way. And we also disseminated our findings and shared our message through conferences, webinars, workshops, and research activity that we collaborated in with others. And in terms of our third work strand, co-production activity, we collaborated and developed links with partnership groups, forums, other projects, other departments within Aberlour, and we collaborated to carry out needs-led pieces of work which explored love in a very specific context. There are lots of examples of the type of work that we engaged in and carried out in our project report. It was extremely varied, which was wonderful, and you can look at that in more detail in the project report. So our overarching question that we maintained throughout the project was, how can we ensure that loving relationships are able to flourish for children and young people who experience care? And this provided us with a real clear framework from which we could find the themes that were within the data that we were collecting from those who were involved in the project. We also maintained a number of other consistent questions when we were running workshops and sessions. And we would adapt our collection methods to suit the context and the audience. And we gathered thematic analysis of the data in a real robust way. I think it's really important to mention here the fact that when our project first began, we thought that we would do so much more relationship-based and relational participatory work directly with children and young people. I would regularly visit Aberlour's residential homes to meet and get to know the young people and the adults who worked there on their own terms, and in their own space. I'd maybe go around and stay for my tea, or I'd have a game of Fortnite, or play on the trampoline. And that was always really nice. And although most of the young people were quite happy to sit and have a chat with me at times about life and what they've been up to, when I would start asking questions about love and I would get my sheets of paper and pens out, people would quite quickly start disappearing. And this wasn't an unexpected response, because love is a real complex and challenging thing to talk about sometimes. And some young people would only think about it in a romantic or an intimate way. As one young person used to say, "Oh, she's here to talk about the birds and the bees with us," and they would feel embarrassed by me bringing it up. And there was others that really just wanted to disengage with what we were doing. And when I used to speak to the adults about that and say, is there other ways that I can think about exploring this with them, they would explain to me that it was often because of real complex family relationships that was hard for their young people to think about. and that was what they related love to, and it was something that they wanted to avoid talking about. But whilst I was in the houses, although there was a resistance to talking about love, there was amazing examples of love happening in action all the time. Beautiful, loving actions and interactions between adults and young people. Silly jokes and shared looks and snuggles on the sofa, shared activities, real empathetic and gentle and loving responses to distress. You could see the loving relationships between the adults and the young people. And the young people and the adults were able to both reciprocate and receive these loving actions. But they weren't always able to explicitly think about it as love. The young people could describe it to me as kindness, or would say that it was the adults doing their jobs, but they weren't necessarily sure that it consisted of love. So we realized how hard it was going to be to talk about love, and that we were going to have to find ways to help both the workforce and young people to think about love that were broader and bigger than what we might focus on within our society just now. And also think about different ways that they could explore it as a workforce, and think about it in terms of their own practice. We also wanted to think about how we reframed professional love and how we could get the adults who worked in the care sector to think about love in a bigger, broader way, and could align that with their professionalism. Because some of our initial sessions with members of the workforce when we first started the project, we would find that when they were thinking about love in a professional context, they felt that they should avoid the word, not the sentiment, but the word, and that they felt that that needed to be reserved for familial or romantic relationships. There was that boundary for them of their professional boundaries, prohibiting them from talking about love openly and explicitly. But we know from all the work and the research that's come before us, and from the explicitness of the findings of the promise and how important love is, and from what our leaders within Scotland say about love, that it is absolutely essential for any child who has experienced anything in their lives. Love is the thing that they need. And a sense of having genuine love in a child's life enables them to feel safe and develop authentic and long-lasting connections. And that's why we need to ensure that love is such a fundamental part of their experience. It's so that our children who have had disrupted relationships can experience that love and experience the goodness that that will provide them in terms of allowing them to feel safe, feel contained, and to build a positive self-image. We knew from the work that we did with adults, when we'd observed them, when we spent time in sessions with them, that adults provide loving relationships for our children. But we also understood that the complexity and the subjectivity of love could make it hard to discuss with children and young people. So yeah, we wanted to find ways for the adults who they already had relationships with to initiate those conversations about love, and for them to discuss together what love could look and feel like. And so they could then recognize it and experience more of it in their lives. And in addition to this, we wanted to provide a way for practitioners and professionals to think about love. We wanted them to think about the universality of love and about the myriad of different ways in which we could demonstrate or experience it. We wanted to do this to take away that fear of using that language and to frame love in that context of the importance of it for all of us collectively as humans. We very often, as I say, ask participants in sessions to share the last loving thing that they did, but we would also ask them to share something kind that someone had done, or something kind they'd done for someone else. And we would put the slides together, the kindness and the love, to demonstrate that so many of the actions within kindness and love were transferable. It wasn't that people weren't being loving, but there was that resistance and the fear of using the word in a professional context. There was also some conversations in our reflective sessions about adults saying that telling children that they love them or showing physical affection to a child wouldn't be comfortable and wouldn't be appropriate for that particular child. And then we would re-emphasize with them that that was why it was so important to have that connection and that relationship, and to spend time with that young person, learning the ways in which that individual would feel comfortable being shown love. As we've discussed, in the project, we work with children and young people, and we work with adults who work in the care sector directly and indirectly. And what we realised early on in the project, which then became absolutely apparent as the pandemic hit, was that we wouldn't be able to build as many relationship-based relationships as a small project as we wanted to allow us to explore these conversations. And that was why we wanted to work more with the adults who work with children and get them to explore it with them. Give them the tools and the language to go and explore it with the children that they already had relationships with, rather than us trying to build new ones. So we would talk with the adults about how, and children and young people, about how love can be shown and experienced in a myriad of ways. So it's not just about romantic or familial love, because we felt that that narrow understanding of what love encompasses can be a barrier to young people talking about love. We would have conversations about how love could be demonstrated or felt in pleasurable hobbies or pastimes, in a passion for a particular activity or subject, in shared enjoyable experiences, through keeping someone safe or fighting someone's corner, in small gestures to neighbours and friends, or in activities that benefit the wider community or the environment or are charity based. We felt that talking about love and working in this way, thinking about love, provided young people with an opportunity to talk about love in a broader sense and in a way that allows conversations to open up safely without feeling scary, and about how they could then explore and describe what love means to them and how they can experience more of it in their own individual lives. We also looked at different ways that love was framed in psychology, and social psychology, and in other languages too, such as the Greek types of love. And we utilize these approaches within our training and exploratory sessions. Here's just some of the other ways in which we broadened the language about love. So here's a video of myself, Liz, and Erin, our project participation lead with the Love Inc. project, talking about our experiences talking about love with other professionals, how it felt initially and how it feels now, and whether we've seen any difference in the conversations that are generated about love in the care system now. Hi, Erin.
Hi.
It's lovely to see you, and thank you so much for joining me for a little chat today, because we're just having a little talk, aren't we, today about our experiences talking about love, because we thought it would be really interesting to share that, as it's been quite an interesting journey, hasn't it, in terms of talking to people about love and their responses and their reactions to that word and that concept in a professional context. So I suppose I'm going to start off by asking you, Erin, like, had you really spoken about like love before in any of your roles? I suppose because you did you were a young inspection volunteer with the Care Inspectorate, weren't you? So was love ever anything that kind of came up in conversation in your role?
Not really. It was something that as young inspection volunteers we were trying to introduce. Some of the inspectors were more comfortable with this than others. I think it was just about traditionally, and they're looking at a place of safeguarding the children. There was only one inspector that I ever worked with who would let us ask the young people, do the adults here love you? But often what we would try and do is just look for observations between the relationship with the adult and the young person when we were in inspecting, and just get a bit of a feel for the house that way. But no, it was something that was a new concept to myself as well when I was coming into this role.
Yeah, I think for me, because I worked in sort of psychology and that, so I knew about love and attachment, but again, it was the word itself, love, that was something that I'd never really used in that professional context before. But I think when we came into the project, there was already a lot of stuff going on in the Scottish sort of care landscape, where, you know, Nicola Sturgeon has spoken about that we should come together and love our children who experience care and stuff. So I guess there was already conversations going on, wasn't there, about the importance of love. But we knew that in our project we were going to be exploring that in a lot more sort of depth and detail. So I'm just wondering, like, how how did it make you feel when you first started talking about love?
Initially, I'll be honest, I probably felt a little bit uncomfortable asking the young people, how do you know the adults love you? Do you feel loved in this house, etc. But that was just more about my own personal values and rather than anything else. But when I came into Aberlour, it was evident really, really quickly that the young people were loved by the adults, and it was something that the young people were really comfortable talking about with the adults. And I guess for me, it was just more about the learning of me trying to build that relationship and get to a place where I felt comfortable talking about that with the young people. And actually, when we done some of the sessions, they were more comfortable talking about it with the adults that they had a relationship with rather than me, who was a bit of a stranger. So that was something that was a key sort of finding for me, was that the relationships are just so important, and that actually it's quite difficult to push the young people to talk about a topic that's so important and so massive. And as well, it's different for all of us. You know, love is so different for each individual person. So that was quite difficult initially when I first came into the role.
Obviously, we've done loads of work with other professionals, you know, insight sessions and doing training sessions and stuff. How do you think other professionals from other organisations who work within the care system, what's their response been to what we talk about in terms of love and the importance of it for children and young people who've experienced trauma or who are experiencing care? How have they responded to what we talk about?
Out with the Aberlour organisation, there has been a little bit resistance sometimes when we've been doing training, and I think that's more about an organisational stance rather than individual people. And something that I've always thought is that the love has to come from the leadership and management, and if that's not coming from there and being filtered down, then the staff are a lot more resistant to talking about love. People are a wee bit scared around the language and using that, and it's a whole new concept to them. So there's a wee bit fear of the unknown to them, particularly during some of the training sessions, some adults have spoken about how they have the fear of giving young people false impressions or false hope, etc. And it's not always about saying, I love you, it's about making that child feel loved through other ways.
I suppose that's why we've always tried to talk about love in that bigger, broader way and make it feel more safe, you know? So it's like everybody feels this, everybody experiences this. It's a human experience, you know? That's a really interesting insight, Erin. Thank you so much. Do you feel like in the 3 years that we've been doing this, that there's been a change in attitudes? Can you see it? Or do you feel like it's not quite there yet?
No, definitely. I have seen a change. I would say that there's obviously a lot more longer way to go. But that's always going to be the case, and we're always going to hopefully want to continue and improve. But I definitely have seen changes in that, particularly with the Care Inspectorate as someone who was a young inspection volunteer. Like just the work around what's been going on in there. That's just one specific example that I can think of, but definitely have seen a lot more change. One thing that's really important to reflect on is that I know a lot of this change came about from like the First Minister's aims and ambitions, but I think beforehand there was also a lot of good work going on, and there was a lot of change happening, and a lot of organisations, you know, really did want to embrace that, and it wasn't just because sort of this policy had been put in place or guidance, and it was more about them wanting what's best for the young people. And I think that's something that's really important to recognise as well as the reasons behind why we're doing it.
Thank you so much for sitting and chatting to me today, Erin, and we will catch up again really soon. So one of the key elements of the initial project proposal for Love Inc. was the recruitment of 2 young people who had experience of care settings into the roles of project participation assistants within the project. So we knew and we understood that their roles and their input into the project, as well as their insight and expertise, would be vitally important to the work that we did. But we hadn't realised how fundamental they would be to everything we were learning about loving practice. We've had 4 young people through the project journey working the roles of project participation assistants, and they are the golden thread in the project that links workforce development with our project activities. We have strived to be love-led employers. From the very start, we wanted our approach to employing and supporting our young people to be love-led. We wanted to ensure that what we already knew and that what we were learning through the project activity was being put into practice by how lovingly we employed and supported them. We wanted to provide them with nurturing and containing leadership. We wanted them to have access to many opportunities for professional growth and development. We wanted them to have comprehensive training, and we wanted them to be able to carry out meaningful participation work that they enjoyed. Their roles within the project and the insight that they provide in all our project work also mean that we are constantly learning as an organisation how best to support care experienced young people in a loving way. We learn in our work about the importance of champions for our young people. We approached people to put forward young people that they knew for the roles of project participation assistants, and we supported them to have all the information that they needed to do this. We also allowed space and flexibility in the project development manager's role to provide support for the young people. We also looked carefully at our recruitment approach. We adapted that to be more loving. And we used Ddp Training, which is dyadic developmental practice, and you can read more about that in our project report. We used this training as a way for the project development manager to understand the type of support that our young people in roles such as this might need. and how we could provide that in a trauma responsive way. We also provided Ddp training for our project participation assistants, and this enabled them to have a deeper and different understanding of what happens to children as a result of their experiences, and what we can do if those experiences haven't always been good enough to ensure that they can still thrive and flourish. We felt that this training would help them to understand and safely explore both their own experiences and those of the children that they would be working with. And it would give them the tools and an approach to support working with young people that put this understanding into practice. We also, as trying to be love-led employers, provided support that scaffolded our individual young people's needs. We knew that they would need different types of support to navigate the workplace and their roles, and we took a flexible and individualised approach to their support and supervision. So we provided opportunities to develop in areas of their interest. We would provide support as they gradually started working more independently. We would give them opportunities for autonomy and for decision making, for opportunities to work as part of a team, to share ideas, collaborate, to listen, to be honest and open, to challenge. And we would explore together how we could reflect on our practice. And we also supported them to be brave by listening to them and by acting on any issues that they brought to us and highlighted to us. So we feel that the love-led approach that we put into recruiting and supporting our project participation assistants has allowed us to put love-led, trauma responsive leadership into practice, because through the flexibility of our funders and our partners in terms of how we delivered on our project aims and how we used our budget, that's allowed us to offer young people paid internships opportunities, paid roles within the project after working as volunteers, promoted roles and extra responsibility, training opportunities that are responsive to their own learning needs. None of these things were initially part of the project scope or design, but they evolved and emerged through the project journey as we were trying to be love-led employers and love-led leaders. We feel that supporting our project participation assistants in their roles has taught us what needs to be in place to be love-led employers. In terms of our findings, we've done a lot of research over the past 3 years. We have taken on a thematic analysis of the data that we've collected. And through this, we've come up with three themes, three main themes with a number of sub-themes that allow us to see how we can support a flourishing, loving environment in care settings. So, over the course of our project, we have spoken to hundreds of adults and young people who are part of the care workforce or who have experienced care, and we've explored with them what love means to them. We wanted to focus throughout the project on the necessity for love, how essential that is for any human to experience. We also wanted to find ways to talk about and think about love that help to broaden people's understanding of how love can be a core part of their professional practice. And we meaningfully involved young people with care experience throughout the project journey. We found the three key themes which were intrinsic to how the wider care system can create an environment in which love is able to flourish. Our first key theme was about organisational values. A culture which enables, encourages, and gives permission for loving practice, and which understands at every level the importance of love in all children's care experience. And an environment where the use of the word love is normalised when talking about children's care. In terms of leadership, of an organisation. That is fundamental to an organisation's values. And leadership that embeds a trauma-informed, love-led approach to all elements of work within the organisation is essential. And in terms of the organisational values of the workforce, there needs to be a workforce that is recruited based on its values, and that values are explored during the recruitment process, and jobs are advertised emphasising the importance of bringing their whole self and their core values to the role. We absolutely need values-based organisations that support and nurture trauma-informed and responsive working principles, and that take a top-down, bottom-up approach to this across all work streams within the organisation, not just those in regular direct contact with children and young people. And we need leaders that are comfortable talking about loving our children, because this creates a culture where adults are not just enabled, but expected to provide loving care for our children, and to call it this. We need an organisation which creates permission to speak about loving children, and we need leadership development programs that use trauma-informed and responsive approaches, effective and regular supervision for staff, and containment for staff teams through a supportive and values-based organisational structure. That provides the loving containment for our workforce so that they can provide loving care for our children. We found that adults who work directly with children and young people were frequently able to give us direct examples and describe moments of love and interactions of love with the children that they worked with. But there was a sense from those adults who work directly on the front line with children and young people that there was a lack of understanding about the importance of love within different parts of the organisations that didn't have direct contact with young people. And that they felt that there was also resistance in using that word from adults who do work directly with young people, but who don't feel comfortable using that language. So they felt that there had to be a lot more exploration and discussion and open discussions about values in relation to love. We need a workforce that absolutely believes in the fundamental need for our children and young people to feel loved. And we need this to guide everything that they do in their practice. And providing the workforce with the support to be able to have those transparent, open, and curious conversations with each other and with young people about love and the language around love will help them explore how they can demonstrate love in a way that works for them and for the young people they're connecting with. Our second theme, which is time and space and flexibility. So we need the time and the space to allow relationships to develop and be nurtured. They are key. They are fundamental. And we need to provide additional support or exception. We need the time to do that. That might be essential for a young person who has care experience to succeed in the workplace. So we absolutely need to have the time to do that. And we need the flexibility within standardized organizational structures and processes to ensure that barriers can be removed for young people with care experience. So much of the data that we analysed, so much of the responses from adults and children, when we thought about what loving acts were, was about having the time and the space to build, nurture, and maintain relationships. It was about the small gestures that can make someone feel seen, known, and understood. Sometimes it was a physical gesture, but often it was about something being thoughtful and a sense of knowing that person well enough to know what they might need at that particular moment in time. We know that time is a precious resource in care settings, and as such it is limited. But providing more time for adults to just be with kids by challenging our own beliefs about the importance of being task-driven whilst we're at work, when our work is care. And by exploring with staff teams our beliefs around what is a useful way of spending time with our children, we can create environments where love can flourish. And we must also think relationally about our young people with care experience when we recruit them into the workplace, in the same way that we would about when thinking about our own families and how they might succeed within the workplace. We need to ensure that processes can be maneuvered to provide this. Things like time off or flexibility in working patterns, expenses being provided, all these things. In terms of our approach in Love Inc., we feel that our partnership working and the approach of our partners, which offered collective leadership alongside flexibility, allowed us to be responsive and give us the time, space, and flexibility to do that. We had flexibility to allow us to create a loving, nurturing, and supportive environment for our project team. We offered work experience, placement opportunities, flexibility in hours, learning opportunities. And as a project development manager, I had the space to be a mentor as well as a manager and to build genuine, loving relationships with the team. And this allowed them to feel contained and supported in what was a really difficult time. It also allowed them to learn at their own pace, but they were scaffolded to build on that and to take new opportunities. And we also spent time doing the other elements of building loving relationships, which is sharing news, laughing together, checking in on each other, emotional support, and positive feedback. We had the space to take care of our relationships as well as to do our jobs, and that made a huge difference. Our whole team's values about love were aligned, which made for a loving working environment, of course. But the understanding and the support of our funders and our partnership organisations and their belief of the value in working in this relationship-based way allowed us to be really responsive and loving for our project participation assistants. And we also got to see how flexibility in organisational processes was vitally important. We adapted and changed many elements of our recruitment processes, which you can read more about in the project report, to make them more responsive to young people with care experience. What we did realise is that even despite our best intentions, some standardised processes and structures were still creating barriers that we hadn't even considered. So we have to keep working on that. We've never got it right. We have to keep exploring. Our final theme, as I say, was about trust and transparency. And trust and transparency is fundamental in terms of the workforce and getting them to use their values and their professional judgment to provide appropriate loving relationships for children and young people. If we have trust and transparency in our workforce, if we recruit them based on their values, then we will be able to do that. It's also about creating a culture and having an environment where all adults are encouraged to curiously question, supportively challenge, and critically reflect on their own and other people's practice. And we need to demystify love by offering opportunities for adults and children to explore really safely the meanings, the feelings, and the language around love and the many different forms that it can take. We need organisations and environments where adults feel safe addressing any worries or concerns openly, or talking through these situations with peers or managers, and where mistakes are part of a reflective process of growth and development. We need to allow those we entrust with looking after our children to be humane, loving professionals who use their professional knowledge and skills and their hearts and values to create opportunities for loving relationships and experiences, and to discuss and understand them in a safe and supportive way with our children to help them to grow, flourish, and succeed. So we found that relationships were fundamental, and we've mentioned this a few times. And we took an approach within Loving of prioritising our relationships. We did this by learning from the role modelling of the approach by our funders, the Life Changes Trust, by the approach we took to partnership working, and through our own experience of gathering the views of the workforce and young people. Just here we've got a video with Erin and Mary, who was one of our partnership links from the Care Inspectorate, talking about their connections, their relationship, and how that led to us all working together, and how organically that evolved, and about the importance of that and those connections and those relationships, and also about the importance of relationships when we're ensuring that young people are meaningfully involved in any sort of participation work.
Hi everyone, I'm Erin McGuigan. I'm the Project Participation Assistant from the Love Inc project, and I have Mary Morris here with me today from the Care Inspectorate. Mary, would you like to introduce yourself and tell everyone a little bit about what you do within the Care Inspectorate?
Thanks, Erin. Yeah, I'm Mary Morris. I'm a team manager now in the Children and Young People's team. So basically, I line manage and support a team of inspectors who are in regulating and inspecting a range of services for children, so children's houses, some of the schools, even secure services and fostering and adoption services.
And Mary is one of the project partners from the Care Inspectorate, so she's been quite involved with us during the whole process of the project. Thankfully, I actually knew Mary before, so I had a good relationship there, didn't we, Mary, when it came to working together. Are you able to just tell us a little bit about your involvement with the Love Inc project?
Yeah, of course. Yeah, so I think it must be about 3, maybe 4 years ago now, 3.5 anyway. And there was information circulated from Janice Gibson, who used to work in the Care Inspectorate, about that this project was getting going. It wasn't it didn't have a name at that time. And she was looking for people to be involved and support the project. And I had a connection at the time, I still do, with Aberlour. So I kind of thought, oh yeah, that looks really good, and checked out that it was okay for me to be involved. And even though I've actually done a couple of different things in the Care Inspectorate during the time, I've been really lucky to kind of stay involved and see the project evolve. And you know, as you say, we've been we knew each other a wee bit before. So yeah, so I feel really lucky that I've been able to kind of stick with it. But there was a wee bit of me that wanted to, you know, I would have been kind of arguing that it was important to stay involved, but also because you know, it was interesting to me. I was curious about it. I wanted to see where it was going to go.
And that's really good then that the Care Inspectorate have allowed that, you know, if it's something that's really important to you, to allow that time to make sure that you are still involved. That's been really good. And it's been great because it's been you throughout the whole process. So like you say, Mary, you've got to see it evolve. It's not been different people, you know, so that's been really, really good for us to keep that relationship and connection the whole time throughout the project. I just want to talk a little bit about the involvement that we had during the PDA session, and how you think that impacted on the practice of the inspectors, Mary.
Yeah, so this was when I was working with the team who the PDA's Professional Development Award. So it's the qualification that inspectors have to get. And for a while I was seconded into that team. And like everybody else, we went from having lots of face-to-face meetings to having to work really differently, remotely. But very, very keen really to ensure that the voice of lived experience influenced training, influenced every aspect really of the Care Inspectorate's work. And inspectors were, it's a really great course, and they have an opportunity to complete a project, something they're really interested in, they're passionate about, and they kind of come up with an idea and kind of get some support, take it from there. But we thought it'd be really good, and again, because we knew you and Liz, it thought it'd be really good if inspectors, when they were, it wasn't like The Apprentice or anything.
No, not at all.
But when they were talking us through, pitching their ideas a wee bit, so we could, give some feedback and be constructive and supportive from the award kind of point of view. But again, just thought what a difference it would be if yourself and Liz were involved and could kind of just keep that focus on people in services, in particular children.
Yeah.
And I think that worked really, really well. I know the inspectors really thought about things slightly differently. I think the projects actually all ended up having quite a strong participation kind of basis, and ensuring as far as possible that they always considered what was important to children and young people in services. So that was kind of a win-win. I don't think we'd anticipated that would happen, but it just seemed to work really well, I think.
Yeah, and it seemed to work really, really well for us as well, because myself and Liz were saying that, some of the projects that the inspectors presented to us, we were learning from them as well, about different theories and legislation that goes into it. And so for me, it was a massive help for my own future career as well. So it definitely was a two-way process. It was really, really good, and we feel it was just something that worked really, really well. Definitely. It was really positive. So I just want to ask if you think that the project has had a bit of a legacy within the Care Inspectorate, or changed any ways in the way that people are using sort of love-led practice, or it might even be personally for yourself. I know you always done that anyway, but if there's anything you feel you've learnt from working with us.
Yeah, lots. I think actually it's like we've been on a kind of parallel kind of pathway, because I think that was, with the promise, the health and social care standards, that was kind of where we were moving towards anyway. But the messages from Loving really chime with that, really support that. And we are certainly this year in the Children and Young People's team really, really having a very strong focus on children being safe and feeling loved, feeling special. So I think that's, we'll refer to the Loving project, we'll check things out. It's kind of a journey. I don't think we're there yet.
Yeah.
I think there's still a lot more to think about and explore about what being loved, if you're a young person in care, what that means to you, but also how we can kind of make sure that's right. And it's not as simple as people just saying, oh yeah, I feel loved, tick. It's much more complicated. But hopefully some of those qualities about warmth, compassion, affection, being special, and feeling that people are on your side and shouting for you and looking out for you, hopefully that's the things that we'll be really focusing on. So I think that is, a nice legacy, and nice kind of parallel kind of approach.
Definitely, and I think that's something that we've found throughout the project as well, Mary, that it's not one tick box for everybody. Love means different things to lots of children and young people, and it's about spending that time and finding out what does love mean to them. So you're 100% right. Yeah. Thank you.
Thank you, Erin. Lovely to see you.
So I always put this quote at the end of our sessions because I feel like it really ties up neatly what it is that we're looking at when we think about love within a context of working or professionalism. Affection is just one ingredient of love. To truly love, we have to mix various ingredients: care, affection, recognition, respect, commitment, and trust, as well as open and honest communication. We set out to explore how we could ensure that loving relationships are able to flourish for children and young people who experience care. And we hope that the conversations, discussions, and opportunities for sharing and reflection that we've created during the project will help to create a legacy of more love within the care system. And we also hope that our report, the videos that we've created, that you can access, will help to continue to support the workforce to explore love with children and young people, and that this exploration will continue to build the narrative and the understanding that love has to be a core part of every child and young person's life experience, and certainly a core part of every child or young person's care experience. We know that love means something different to everyone. And yet, having asked so many hundreds of people to tell us about love for the past 3 years, we found it is experienced and shown in lots of very similar ways. Love is something that can be really complex to explain or clearly articulate, but it can also be in the simplest acts that we feel it. It can be fleeting, sustained, or enduring. It can last for a certain period of your life and not another. It can change shape. It can come and go. It can be wonderful, and it can hurt. But everyone needs it, and everyone deserves to experience it. And our children need it to heal and grow and trust and thrive and go on to have positive, loving lives in the future. And it is our responsibility as those who have the privilege of caring for these children and young people to ensure that they experience as much love as possible in their lives. Thanks for joining us today.